and welcome to Local Doctors on Call. I'm Candace McElia. If you or a loved one suffer from low vision, you know the condition can be very frustrating. Low vision refers to visual impairment that cannot be corrected with surgery, drugs, glasses, or contact lenses. It is often characterized by blurred vision, blind spots, or tunnel vision and impacts people of all ages, but especially older adults. However, there are ways to make the most of your remaining sight. Tonight, to help us understand low vision and find out new ways to remain independent, we have local low vision specialist Dr. Stephen Bovio and Dr. Kathleen McCabe joining us on the show. Dr. Stephen Bovio is a board-certified optometric physician. He has been in practice for 17 years. The name of his practice is Gulf Coast Eye Center. He specialized in primary eye care for all ages, dry eye syndrome, contact lenses, and low vision. He's also a member of the American Optometry Association and the Florida Optometric Association. His practice participates in many charitable programs such as the Infant C program through the AOA and Optometry Giving Site. Welcome to the show, both of you. Welcome back, Dr. McCabe. Welcome, Dr. Bovio. Thank you so much for being here. So for those of us that don't know, our viewers that don't know your background, tell us a little bit about yourself, Dr. McCabe.
Sure. I'm happy to be here again. I practice general ophthalmology with a specialization in cataracts and refractive surgery, and I do that at the Eye Associates here in Sarasota and in Bradenton. I've been here for 3 years. I practiced for about 10 years before that in Indiana, and I did my training at Bascom Palmer in Miami, and it's been a wonderful transition here back to Florida.
That's great. And now I do understand that you were just granted membership into the American College of Eye Surgeons. Congratulations.
Congratulations. Yeah, thank you.
Now, what does that mean for our viewers?
Well, it's a process that you go through as a surgeon. You know, when we come out of our training, we're all certified to do surgery, but there is, of course, different levels of surgery that people achieve as they gain experience. And this is a method of certification that at least kind of levels the playing field. There's a process to go through as far as review of surgical tapes, consecutive ones, 50 that are submitted. And and then you have somebody who actually observes you in surgery, and it's quite an honor, and it's a very select group of people, and I'm happy to be a part of it.
That's fabulous. Congrats again.
Yeah, thank you.
So our topic tonight is low vision, and Dr. Bovio, I'm going to start off with a question for you. What's the difference between a low vision eye exam and just a routine eye exam?
Okay, yeah, a low vision exam, the patients with the loss of vision are not going to be able to do this normal testing. So we have special testing techniques for them. For instance, the standard chart on the wall is going to be too small for them. So we have a larger print chart for them that we can actually bring closer to them. And that way we can get a response from them. And this is critical because these exact measurements are what are used to calculate the right magnification, the right techniques, the right instruments to help them see better. So it's probably the most important part of the exam. For instance, we'll ask them to bring their magnifiers in with them for the exam, and they'll bring a bag of magnifiers, and invariably they're like, I brought this, but none of them work. They can't do anything with them. Well, they were never measured for those. They were just randomly giving magnifiers hoping they would work. But if you spend the time to get the exact measurements, we have great success.
Okay, and so what are some of the eye conditions that would warrant then a low eye vision exam?
Yeah, some of them are hereditary, like retinitis pigmentosa. Some of them might be an injury. More often, though, it's diabetic retinopathy, it's glaucoma, it's macular degeneration. Interesting on those last three, though, a lot of those things are preventable to getting to the point where they need low vision. You know, the glaucoma patients are treated early. They should be able to save their vision. I had a patient just this year who came in, hadn't had an exam in 15 years, had the exam, and sure enough, she had glaucoma the whole time, wasn't treated. All that vision's lost. We can't bring it back. Wow. It's just something that should never have happened. Diabetic patients, invariably, they don't know their blood sugar. They're not doing their job. They're not. And that will lead to diabetic retinopathy, and that will lead to vision problems. If they just take care of themselves, you can prevent the low vision need. And then macular degeneration, I know your office and our office have equipment now that within a minute it can tell you if it's wet or dry. New treatment with wet macular degeneration can really save the eye from going really south. So there's a lot of things that people need to be aware of.
Yeah, and I guess speaking about diabetic retinopathy too, a lot of patients can have really significant diabetic disease in the eye and still have good vision in the central vision, but be on the precipice of really having a severe condition that can cause severe loss of vision. And they just, you know, don't realize it and don't go in for their regular visit.
When they think they're seeing okay, they don't go in.
And if we had looked in there and seen that something was brewing, we might have been able to do some treatment that would help prevent them from getting to the position they're in now.
Yeah, absolutely.
So yeah, that's a really good point about how
patients
important
need
it
to
is
take control of their health and be on top of that.
Absolutely. That's a recurring theme that we talk about pretty much every week, is that it's so much better to just be proactive rather than to react when it's too late. So are there any other challenges that a low vision patient might face?
There's a lot of challenges. The vision is bothered by either decreased visual acuity, peripheral vision, some areas are missing, loss of contrast, sensitivity, double vision, distortion. So you can imagine this can cause a lot of issues. Most of the patients have more than one of the things going on at the same time. Most of them have it worse in one eye than the other. So it is a challenge. This can affect every aspect of their life: driving, reading standard size print, functioning on the job, hobbies. And then invariably that can lead into being able to function in everyday life and live independently. These patients have worked hard their whole life. The last thing they want to do is give up their freedom. So we want to help them, and there's hope. If they are willing to accept the vision loss, and there's a little of acceptance there, but work hard at what they have and accept the help that's out there, we can often help them keep their independence.
Which is great news. And so speaking of help, what are some of the treatments available for low vision patients?
Treatments. The treatments are coming, they're really expanding. The magnification, all these devices are trying to enlarge the image onto the retina. Different magnification devices are going to have the same magnification, but deliver it differently. And we got to find the right one for the right patient. So for distance, we have the handheld telescope. Handheld telescope works okay for spotting things far away, for maybe like a sporting event or something like that. But it takes a lot of dexterity. You got to hold the telescope still. So it's limited in what its use is. Then we have the spectacle telescope. This can be mounted onto the spectacle, you know, flip on. And that's nice because your hands are free. So it's stable, you can see something. That would be good for maybe teaching, going to the classroom, TV, or maybe a concert.
So lots of different things.
Yeah.
I think we do have a caller right now, though, Linda, on the line.
Sure.
So maybe we can just take a break and see what Linda wants, and then we'll come right back to that.
Sounds good.
Hey, Linda, go right ahead with your question. You're live on the air.
Okay. I have histoplasmosis, and I'm losing my eyesight. My right eye.
Go ahead. Are you still there?
My left eye is still okay, but I've been told there's nothing they can do for me. So I will go blind, they told me. So what can I do about it?
What was the disease?
So Linda, it sounds like you have something called histoplasmosis. Is that what they told you? Okay.
It's caused by bird feces.
Yes.
When I was 16 years old, I worked in a convent in Germany and a chicken farm.
Yep, and that's exactly what we see with patients such as yourself, is that there's a history of a lot of times living in the Midwest even, and on a farm. And so what that can do is cause you to develop something that's very similar to wet macular degeneration. And in that case, there are some treatments, the same treatments really that we would use for wet macular degeneration can be applied to your condition. But as Dr. Bovio said, sometimes even with the best treatment, or if treatment wasn't timely enough, you can have some permanent loss of vision, and that's where those low vision aids that he's able to provide can really help. And are there some things that you've seen in those patients, Dr. Bovio?
Yeah, some of the magnification devices have really helped in those patients.
So even the closed circuit TV
Yeah,
kind of
the closed
things,
circuit TV, some of the things we're going to talk about down the road, the video magnifiers work really well. It's a real clear image. It's like the closed circuit TV, but you can hold it in your hand, and you can do the multiple different magnifications quickly in your hand. You can do different contrasts in your hand. You can take a photo of something if you want to take it to across the room, and maybe a phone number, go across the room and do that. But there's a lot of different things, but the telemicroscopes would really help in that situation.
Great.
All right, great. Well, thank you so much for your call, and our phone lines are still open, but we're going to take a quick break with much more to come, so don't go anywhere. Local Doctors on Call will be right back. Here's an important reminder: if you would like to hear again about low vision, or if you think a friend or family member could benefit from seeing this show, be sure to tune in Sunday morning at 10:30 for an encore presentation of Local Doctors on Call with our guests, Dr. Stephen Bovio and Kathleen McCabe. That's Sunday morning at 10:30 a.m. right here on SNN Local News. Welcome back, and we're talking about low vision tonight. We are joined by Dr. Stephen Bovio and Dr. Kathleen McCabe. So before the break, we had a great caller with another question. We do have a caller on the line, and then we're going to get more into about treatment for low vision.
Right.
All right. So we do have a caller on the line. Hi, Lori. Welcome to the show. Go right ahead with your question.
Okay, it's not a question. I'm watching you on TV, and it's in regards. I have glaucoma on both eyes and cataracts. I went into responsible. Yeah, I'm trying to look at the receipt so I can tell you who I saw. Dr. Stump, and I'm signed up at the Senior Friendship Center, and that it doesn't happen until January. In other words, there's a long list for places that take care of the eye injuries.
Right.
Did you have a question?
I'm not in pain. I'm not saying I'm in pain. It's just I'm as blind as a bat.
Yeah.
Well, Dr. McCabe will tell you that cataract surgery is pretty much routine now, and she'd be excellent at that. So we can take care of that. And glaucoma is, really easy to treat these days. So you need to get in there and get your treatment. You need to get there.
Yeah, and as Dr. Bovio was stating, you really do need to do your treatment for your glaucoma. And so if you're on glaucoma medications, even though you're not able to get in right away, make sure that you have them and that you're using them on a regular basis. Yes. Because as you pointed out before, once damage happens from glaucoma, unfortunately, we really can't reverse that damage, and it's all about prevention. So hopefully you're on medication, continue to take it until you can be seen, and hopefully we can get you in pretty quickly. We do some work with Senior Friendship Center too, so sometimes we're able to facilitate that a little bit.
Yeah.
So let's talk a little bit more about treatment and the good news for patients with low vision. You had started to talk a little bit about the treatment, but I know there's a lot more.
There's the telescopes, and back to the telescopes, the biopic telescope. That's a unique telescope because that is mounted on the top of the eyeglass frame, and that allows patients to be mobile. They can walk around normally, and then when they want to see distance, they just tip their head down and they can look through the telescope far away. That's great for vocation and education type settings, but also, interestingly enough, in 75% of the states in the United States, that's approved for driving. It's not approved in Florida for driving, but some patients are driving with that. Then you have the full lens telescope, and that one you can't walk around with. That has a wider field of view, but again, that's just for certain type objects you're trying to see far away. Then we go into the microscopes. We've all seen the handheld microscopes. Those are good for quick glimpses of the receipts, medicine bottle, those kind of things, but not really practical for reading a book. Then we have the stand magnifier. The stand magnifier is nice because it's stationary. You don't have to have great dexterity. You put the book underneath it. It's already focused for that distance. And it gives you a wide field of view, and you can read pretty fluently with that. So, and it comes with a nice light, and patients do really well with that. And then what I like to use more is the spectacle microscope, and this is where you put the full prescription into the eyeglass frame. And with that, if you put the full magnification into the eyeglasses, you have to hold things really close. But if we put prism in it, you can hold it at a normal distance, and you can read much more fluently. And this is how patients are trained to read. They can read really well that way. So that's my go-to if I can do it. It works best when both eyes are equally impaired, usually. But that's been really, really helpful. Okay. Then the next thing is the video magnifiers. Those work really well. They take a video of video image of the material, and then they enlarge it onto a screen, whether a TV or a just a handheld type screen. And those have been around for a long time. Listeners probably might know it as a CCTV.
Okay.
You put the reading material under the microscope and it shows up on a TV screen. You can read a lot of things, and they've come a long way with that. But what they've really made progress on is there's a handheld version where you can hold it in your hand. You can set it flat down, and again, we were talking about it earlier, multiple magnifications and different contrast. You can make it white on black, black on white, yellow on black. Real quick, you can take a photo of it, and you go across the room, and you can do something with that. So all these different magnification devices are important. It's very important to get the right measurements to find the right device for the right person.
Right.
A lot of these things need the right illumination. That's key too. Glare is really important. We use an OT lamp. An OT lamp gives you natural daylight lighting. It's cool, but it really takes out the glare. You can see a lot better. And then contrast is so important. The right magnification device won't work well without the right contrast. We use a yellow, an orange, or an amber lens. It gives you much more contrast. Those eliminate the blue light. That really works well. We've done great with that lens, those lenses.
You know, as you can imagine, this is a lot of different devices, and so not everybody has all of this available to evaluate with a patient, and so we do send quite a few low vision patients to Dr. Bovio because he has that expertise and he has devices that they can kind of get a feel for what's out there.
Sure.
And that is a long visit. That's really involved, and I know that you in your office really spend a lot of time with the patient, try to figure out what tasks they need to do. And you know, it's very
important. You got to find out
individualized.
what their goal is, and then we focus on their goals. It might be reading music, it might be on the computer, it might be playing cards.
Right.
You got to focus on that.
Specific to their needs.
Yes.
And I'm sure that you do see a lot of low vision patients in your office.
Absolutely.
So tell me about that, and then how does that work with the coordination of working with Dr. Bovio?
Well, you know, we do see a lot of low vision patients that we have that have these kinds of diseases that just there isn't anything we can further do either medically or surgically to improve their vision, and they're really not functioning as well. And I try to send patients really a little bit sooner than you might think. They're not really struggling in a big way, just in an earlier way.
Too, because it's better early on, because I get patients who are really gone, they've really lost a lot of vision. I do all this work and they're seeing things for the first time in maybe 3 or 4 years. Their brain has to almost relearn how to read. It takes a lot of patience and a lot of work, but if we get them at an early stage, we're just giving them magnification. They're not losing a beat because they're reading all along. As they need more, unfortunately some do, we just upgrade the magnification, and it's a much easier adaptation. But if you wait late, it's hard, Yeah,
we're really not set up in our office to provide all of that or to have that dedicated person who is just familiar with everything that's out there and with what the needs of the patient might be. And Dr. Bovio is dedicated, so it's really wonderful having him in our community. And I send patients from pretty far away to see him because I really think that he does an excellent job.
That's
I
great
really appreciate
that you can coordinate like that, which is wonderful. Well, we have a lot more to come on Local Doctors on Call. Want to give you a quick reminder that our phone lines are open. The number to call if you have a question is 361-4675, and we'll be right back after this quick break. Welcome back to Local Doctors on Call. Our topic tonight is low vision, and we just want to remind everyone at home that if you have more questions about low vision and you want to get in touch with Dr. Bovio's office, we want to give you all that information, and we're going to put it right there up on the screen. Dr. Bovio is at the Gulf Coast Eye Center, and you can see their phone number up there is 921-2020, or you can check them out online at gulfcoasteyecenter.com, or they are on Facebook, as we were talking about a little bit before the show. So that's where you can reach Dr. Bovio. But before the break, we were talking a little bit about the coordination between your office at the Eye Associates and between your practice. So let's talk a little bit more about how that works and when you know it's time to refer someone to his office.
Yeah, and as I was mentioning earlier, the trick is to try to have patients understand that their disease process may be something that's progressive that we can't really stop. For instance, macular degeneration.
Right.
They may have gotten to the point where they're really starting to struggle with some of the activities that they normally enjoyed or need to perform, like writing checks, or they like to do crossword puzzles and they just can't do it any longer, or it's more difficult. And I really encourage patients, even when it's just beginning to be a difficulty, for them to get in contact with Dr. Bovio, because like he mentioned, that is really the introduction to some of those aids, and it's sort of a seamless progression then for them, where they can really remain functional.
Sure.
But patients can be a little bit resistant because they really don't want to think of themselves as somebody with low vision.
Right.
You know, it seems like they're handicapped
And
in a
that's what I
way.
meant by acceptance earlier. Once they accept it, you know, they realize we can't do anything more medically.
Right.
Let's work with what you got. We really see good progress at that point.
Right,
No,
and I think family members can really be helpful, and for our viewers, I really wanted to tell them that really, if you see that your loved one is struggling and they're a little bit resistant to trying to get help that's other than surgical help or maybe a drop that might help, really to encourage them to go and just have a consultation.
Yeah.
As you can see, Dr. Bovio is a really approachable and nice guy, and they'll have a good experience there.
Yeah,
so.
and you know, one of the signs, if you can't read medicine bottle with your best pair of glasses on, if you're getting injections for macular degeneration, these are all things, areas where you might be a candidate at that point. You know.
Okay. Now, are you seeing an increased number of low vision patients?
And you know, we live in Florida, and the baby boomers are coming, and I think the estimate is between 4 to 8 million people are visually impaired in America. But they estimate that to double by the year 2030.
Really?
So there's baby boomers are coming along, so it will be more and more of a need for this.
Wow.
Yeah.
So now you were mentioning before some of the treatments allow people to still drive, but that kind of begs the question. So let's talk a little bit about safety and low vision. I'm sure there are some tips that you can offer people who may be struggling with this.
Yeah, and there are actually some home health care kind of things that can be done that help patients to even navigate around their home, where you can take and put brightly colored tape around the edges of furniture and things like that. And so sometimes not only getting the patient plugged in with Dr. Bovio, but some of those services that'll actually come right to your home and try to help with the safety of the person who lives there, and that can be very helpful. So
Yes, exactly. That leads into Lighthouse of the Blind, which is, we're very fortunate to have that here. It's Minnesota Lighthouse for the Blind. It's by the airport. And they are a nonprofit, nationally recognized private company that help people maintain their normal lifestyle, whether they come to their home, like you said, and help them get around their home and you know, make the cooking easier, make getting the mail easier, you know, making everything a little easier for them, and then have classes at the facility as well. So it's like we all work together. You get the best vision, best possible, you know, magnification, best, and then they work with, you know, life skills.
Right.
And
even
things like
in
that.
the home kind
yeah.
of aids.
And then the
things
home
like
is
that.
important. I can't go, you know, and we need people that can, and we have occupational therapists and people such as that will go and help them.
It really is a team approach
Yeah.
for these patients, and so when they get all of those aspects touched by the different professionals, that's a unified type of care that can really help them function better. And one of the things I wanted to mention too is that if you're able to do things that help these patients with low vision to function better and more independently, it's good for them because they want to be independent, but it's also good for the person that's helping them in their family that can't maybe do other things that they need to in their family life because they're so dedicated to taking care of that patient. So it has this ripple effect throughout a family that you're not just helping the patient themselves, which is wonderful, but also the person whose time has been tied up by trying to help their loved one.
So I guess probably the best advice that you could give to patients, viewers that are watching, is if they're struggling with this, to really come in and get checked out early and have that conversation.
Yes.
Is that
Early,
true?
regular eye exams can prevent this from happening, maybe, in the first place. And don't give up. If you're in this situation, there is help. There are things we can do.
Now, I know one thing we always talk about are clinical studies.
Yes.
Are there any clinical studies going on right now that might help people with low vision or in this area?
Absolutely. We have a clinical trial that we are participating in. It's a lens-based trial for cataract surgery patients, and it specifically targets patients with moderate loss of vision due to macular degeneration. It's sort of that early entry patient for low vision, the patients who are starting to need handheld magnifiers to read, and it's really not working out really well for them. They're struggling still. And this is a lens that's implanted at the time of cataract surgery that has a very powerful reading aid within the design of the lens, but also delivers distance vision in that eye as well.
Oh my God.
And so it's really an exciting technology in the fact that there are no increased side effects or risks compared to a normal implant. The design of the implant is very similar to a regular implant we would put in, as opposed to the implantable telescope, which has really some significant complications that are possible with that. So it's exciting to be a part of these new technologies that are coming out. And if you have a patient, a loved one, a friend, a family member, or you are somebody who has moderate macular degeneration and cataracts and is struggling with the use of a magnifier and think you might be a candidate for the study, we would love to hear from you, and we would be happy to see if that might apply.
The optics of the idea of that is much better than, you know, the closer into the eye, the optics are going to be much more crisp. So there's a lot of potential for that to be very successful.
Yeah, it's
and
very exciting.
When we talk about technology, I know you have some pretty technologically advanced things at your office. Can you just briefly, we have about a minute left, briefly touch on some of the really cool things you have going on at your practice?
Oh, well, the list goes on. You know, we have new dry eye treatments, we have new, you know, osmolarity testing, we got EKG for the eye, we have VEP measures, you know, the response time through stimulus to the retina. You know, all these things, you know, the OCTs, we all have those, you know, all those things. So the list goes on, but, you know, the low vision stuff particularly is changing almost daily. And Eschenbach is one of the leaders in that, developing those types of magnification devices. And we're always looking for the best, latest, greatest thing, and for the right patient.
That's great.
Yeah.
Well, before we go, we want to remind our viewers that at the Eye Associates, they do host weekly free cataract seminars. So if you're interested in attending one of those seminars, we've got one coming up, hosted by Kathleen McCabe, Dr. McCabe. So thank you so much for joining us tonight. Thank you, Drs. Bovio and McCabe. Great information as
Appreciate
always.
it. Thank you.
And from all of us here at SNN, thanks for watching and have a great night.